When I started working at the University of Kentucky in 1998, I had a dream that this would happen, but I never expected it to happen.
The most important part of healthcare education is people, but there are other indispensable resources. Bricks and mortar is a very important part of the recipe to produce a talented, well-qualified group of doctors.
The Rankin Health Education Building will create an opportunity to train more to enhance the workforce for all of Kentucky.
We've struggled at times in the past because we did not have adequate resources. Classrooms were too small. We weren't able to accommodate the numbers of students that we really need in order to serve the needs of our population.
I think health is complex, and I think health of Kentucky is a complex challenge for us. And as the flagship land grant institution, the University of Kentucky is wanting to tackle that. And I think the Health Education Building is a great way to do that, because it's saying we need a systems approach where we're bringing everybody to the table who is in these health-related areas and training them to work collaboratively, because that's what they're going to be expected to do when they leave here.
The Health Education Building is designed for exactly that. Multiple colleges, multiple disciplines. Could you imagine students having access to other students and other leadership and instructors of all different disciplines in one place?
The complex problems that we deal with in healthcare are critical. They're literally, in some cases, life and death. So we need to make sure that the students that we work with understand how to deal with these complex problems with patients the best they can in a team environment.
The possibilities are endless. This is opening up so many creative ways where we can expand what it means to be a doctor, how we can serve the people that call upon us to be served.
Lots of students who come to UK with that health interest, that they need a place to explore, right? They need a place to explore the fact that they have a health interest, but they don't exactly know the career options that are possible. They don't have a full training yet on the health system. We know that they have a passion for making the world a better place. That is the underlying thing that we see in our students. I think that by having them come together, that we can help take that passion and train it into action. And so that those actionable careers, that they can be doing this work. And the Health Education Building is going to give us an opportunity to show them all of the different ways they can do that.
It makes me feel that University of Kentucky really truly cares about our Kentucky people. They really care about the patient outcome and us as people, so I think they put a lot of work into it to give us better foundation and education for students.
We see and we review so many applications from students who speak about healthcare access and them and their family members having to travel hours to find healthcare because it's just not available in our rural areas.
My goal is not to develop future health professionals that work at the University of Kentucky or any other academic medical center. It may happen, and I'm happy when that happens. What I really want them to do is to go out back to their communities, preferably, in my opinion, where they grew up or where they've lived, and work with the populations in those communities. That's really, I think, what we should be thinking about in an academic medical center. We're not trying to make sure that Fayette County has the best, and brightest health professionals. We want to make sure that the Commonwealth of Kentucky has the best and the brightest health professionals.
For the next generation, this building is a 100-year building. This is going to be important for a long time. It's going to affect so many lives and so many young people. So it's exciting to be part of it.